So before I start each procedure, I like to choose the tip size that I'm going to be using for my client. We have a couple different sizes, like I talked about before at the beginning of the video. We have one that has a smaller opening and one that has a larger opening. I have a personal preference to using the larger opening. However, you can switch back and forth if you want to. I need every single person to know these are not to be used on multiple people without having them sterilized. You can do a wet sterilization with quats, which I'm sure everyone has in their salon or their spa. I highly recommend that you stock yourself up on these, and then that way every time a new client comes in, you can just go ahead and pull out a brand new sterilized one. After time, usually after anywhere between maybe 15 to 20 treatments or so, you might notice that the little hole is starting to wear down a little bit. It's time to get rid of them and just reorder some new ones. Now, with this hand piece and with the tip that I'm choosing to use, when you slide it onto the hand piece itself, there's a silver notch that is right here. This is very easy to line up. So when you put the tip on, you just want it to line up and push right onto the little silver hole so it lines up perfectly fine. If you're in a hurry and if you accidentally try and shove the thing on there, it's going to crack and break, and then you need to put on a new one. So take your time putting this on. Once it's on, it's pretty much on in place, so it's not going to just fall off in the middle of the treatment. Okay, so I've chosen the larger one. And now we'll go ahead and get started. So any other questions that you can think of as you've been laying here?
No, not yet. I'm ready.
Okay, good. So what I'm going to do is I'm going to go ahead and drape you. And the reason that I like to use a drape is just to kind of keep your clothing protected. And then that way when you get up and leave, you don't have crystals everywhere. The other thing I'm going to do, like I said, is I'm going to go ahead and put some cotton into your ears. And since I'm going to be working all over your face, this is going to prevent some of the little crystals from going into your ears itself. The other thing I'm going to be using on you are some eye pads that are going to be protecting your eyes. I know you and I spoke of that you are concerned about some of the fine lines around your eye area. Where I place the pads, I will be able to work around that area. Okay?
Okay.
So I'm going to put the cotton in. And the machine is fairly quiet, so it's not loud and obtrusive at all. The procedure itself will probably take anywhere from maybe about 10 to 15 minutes or so. Okay? What I'm going to be looking for on your skin is I'm going to be looking to see some color change on your skin. And a lot of people ask, what do you mean color change? I'm going to look to see how pink you're getting, how quickly you're turning pink, and that will kind of tell me where I'm going to be moving around on your face. Okay? The first thing I'm going to start off with is a TheraGlow cleanser. This is a cleanser I'm going to recommend for you. Okay? Since you and I talked about your skincare routine, and I highly recommend that you get on one. And what this is going to do, it's going to cleanse your skin and prepare everything for you. You can use this morning and night. When we do microdermabrasion, your skin has to be totally clean and free of all oils. Otherwise, I don't get a clean contact and we don't get a real good treatment. I will try and leave as much of your lipstick on as possible. Some people are very fussy about their
That's
lipstick.
okay. You can take it off. It's fine.
Okay, good. I will also try and not to mess up your eye makeup, because I do get quite a few people that, like I said, go right back to work after their treatment, and they come in and say, try and keep my eye makeup on, please. And you have no allergic reactions to anything topically that you're aware of?
None that I'm aware of.
Okay, good. This water's going to be a little bit cool. The reason I want to use cool water is I don't want to overstimulate the skin at the beginning. So, at the end of it though, we'll use some warmer water to calm everything down. So overall, your skin looks really good. You do have some areas of congestion that I could feel when I was cleansing it. You do have some little blackheads on your nose that we'll go ahead and eradicate and get rid of those little suckers. We will work around your eye area. Overall, your Texture's really good. Things look great. And after your treatment, like I said, we'll talk a little bit further about how to maintain the results that you're going to get from this.
Okay.
Okay. So now I've got your face all prepared and ready to go. Nice and clean. I've got the cotton in your ears. And like I said, I'm going to be putting some eye pads over your eyes. But the other thing I like my clients to know, since this is your primary treatment, I'm going to start you off a little bit lower, okay? And on your next treatment, when you come in, then we'll talk about how your last treatment was, what did you experience from it, and we'll just kind of keep moving up the level of intensity, okay? Most of the time, I will always start on the forehead, and then I'll move around to one side of the face, the chin, the nose, and then I'll circle back around to the other side of the face, okay? If for any reason you start to feel that it's a little uncomfortable, just tell me, and I can always turn down the intensity. I recommend these eye pads, which you can purchase through Aesthetic Solutions. In my practice, I use these on a regular basis. I used to try and use swim goggles or wet gauze, anything that would protect my clients' eyes, because we are using crystals and they do have a tendency to stick. So I would definitely recommend incorporating these into your routine. And like I said, they are very easy to use. It does not mess up the client's eye makeup.
It feels fine.
Good, okay. So at this point, I'm going to go ahead and turn on the machine. And we're going to go ahead and start. The other thing you're going to feel me doing is just kind of dusting your face a little bit. And that's what I'm going to be doing, is I'm going to be dusting off the crystal so I can see how your skin is reacting. Like I said, I want to see how red it's getting or not red. Okay? Now when you start off on doing a treatment with a client, like we already talked about, you always want to start them out a little bit lower. On your gauge, you're going to notice, I'm at the lowest intensity right now, which is 2.9. I usually will like to turn it up so my gauge reads anywhere from like 4.0 to maybe even a little bit lower. That's a perfect starting point. To start the treatment, you need flat contact with the skin. Do not be afraid to move around the patient's head at all. I like to start at the forehead because it's the largest part on the face, and it's easiest for me to separate the face into quadrants. So I will start at the forehead. You always want to use your fingers as your guide, and you do need some tension on the skin. So, what I'm going to do is pull the skin. I want flat contact. The crystals are coming out. How does that feel?
Fine, a little prickly.
A little prickly?
Feels okay.
Good. So as you can see, the crystals are coming out. It's a nice even flow. It's a nice even pattern. So what I'm going to do is I'm just going to finish doing her forehead. A lot of people ask, how do I do this? Or what's the best way to do it? I personally find a sweeping motion is the easiest way. As you start to work with this machine, you very well might find a different technique that works better for you. There's some individuals that will slide over and pick it up, and slide over and pick it up. That's perfectly
I don't like
fine.
that as much, though.
Did that feel different?
It feels better, the sweeping motion.
It does.
feels better.
Okay, good. So this way, to me, we don't break surface contact whatsoever. The other thing that we always get is, well, how many passes do you do? I usually like to try and do anywhere from 3 to 4 passes on the skin, not necessarily reading what is on my gauge. I pay attention to what the skin is telling me. So at this point, I've passed over numerous times, and I'm going to kind of dust it off and see how she looks. She's nice and pink, which is perfect, which is exactly what I'm looking for. She's also got just a tiny bit of some blotchiness over here, which is perfectly fine. So for me, this is a good starting point. It's nice, it's pink, it's even, there's no flakiness that's coming off. So at this point, I feel safe enough to go ahead and move on. So I'm going to go on to your cheek now. So maybe turn over for me. So from this side of the face, usually what I like to do is I like to take my 3 fingers and just pull up onto the skin so it's tautly. You don't need to pull really, really tight, but you just want some tension so you have the availability to sweep the handpiece onto the skin. So once again, in an upward and a downward motion, I'm just following and using my fingers. How does that feel?
Fine.
Okay. And as you can already see, once again, the crystals are coming out nice and even, so there's no clog or anything. I've got the suction because the skin is turning nice and pink. So this is about 3 passes right in that one little section. So if we dust it off, you can definitely see a difference in between the skin that has not been treated, this skin here, and this skin here. This is a perfect example of the kind of erythema or flushing that you want to see. Once again, you want to pay attention as to what the skin is looking like. You don't necessarily need to pay attention to what the gauge says on the machine. For the jawline, 2 fingers, spread it, and you want to follow the jaw contour. You do not need to press hard with the handpiece. The handpiece does the moving for you. You are just sliding it back and forth, and because the skin is being pulled tautly, you don't get the stickiness, or you won't get the little suction pockets that sometimes you get if you press too hard on the skin. So once again, I'm watching her skin and I'm noticing that it is turning nice and pink, which is what I want. So that's approximately 3 to 4 passes. Dust it off. That's perfect. That's exactly what we want. Now for this area in through here, this area tends to be a lot more sensitive. The skin is a little bit more lax in through here. So at this point, I'm going to choose to turn down my intensity. I'm going to choose to turn it down to possibly like a 3-5. And the reason I want to turn it down, like I said, is because this area is significantly more sensitive. So Amy, now I'm going to go ahead and I'm going to start right in through here on your cheek area, okay?
Okay.
So once again, I'm using my fingers as my guide and the tension. How does that feel? Okay. Is it too much or are you okay?
No, I'm actually okay.
All right, good.
I can tell you're right. It's a little more sensitive, but it's okay.
Good. A lot of people come in and they say, what can I do to get rid of my nasolabial folds, which is the little line right here. This is great in helping to soften it. You can just kind of keep running right over that, just to soften it ever so slightly. Now what I'm also going to do is I'm going to connect this area up here, and I'm going to keep it at the lower intensity because this area tends to be really sensitive also. Now one of the other concerns we had is right here underneath the eye area. The eye area, we're just going to sweep it around, and this is the only time that I will sweep it around and I will pick it up. If you try and sweep it around and then push it back the other direction, the skin folds too much and it sticks. So once again, we've got even crystal flow everywhere. She's turning nice and pink. I'm just going to match everything up. Let's dust her off and see how she looks. She looks good. Now what I want to do is, because I'm going to focus on the nose area and the upper portion of the mouth, the nose, I usually like to tell people I'm going to be moving their nose around a little bit, so they're going to be breathing through their mouth. So excuse me, I'm going to have to squish your nose a little bit so I can get in there, because most people, that's where they complain of where all their blackheads are. For this area, you can do circular motions, you can do little tiny sweeping motions. I personally just try and scrub as much as possible to really get in there and clean that section out, because that's where we get a lot of congestion right here in the corner. And once again, around the nose and for all over the face, you want to make sure that you have direct contact onto the skin. When you don't have direct contact onto the skin, you lose the crystal flow and you lose the vacuum. Now I'm going to go right above your lip. Sometimes you keep your mouth closed for me. This is great for those little lip lines where most people complain that their lipstick bleeds into. So this works phenomenally well for it. This also tells you too, or it also points out why you don't just want to bring in your next client and use the same tip on someone else, because we're going right by the mouth. So you always want to make sure that you change the tip. So we'll dust that off. The brush that I like to use to dust off the crystals, you can get a spray-on antibacterial agent, which will also kill any type of bacteria. I personally just find this very helpful to use instead of actually using gauze. So your nose looks good. It's nice and smooth. Cleaned everything out. Good. Now for the chin, I'm going to go ahead and turn it up a little bit because we were talking about the chin and your congestion. So right now I was at 3/4, so I'm going to turn it back up to probably about a 4 will be good. And at some point, Amy, I'm going to ask you to make a chin for me. And what that means is I want you to kind of stick your tongue right like so. Perfect. But right now I want you to relax. Okay? The chin is always a little bit trickier because you can't really pull the skin too tautly in through here. You do want to go right up to the lip line though. How does that feel? Okay, that's okay. Not too uncomfortable? A lot of people ask, or I get a lot of questions, well, what kind of pattern should I do? I don't understand. Should I go back and forth? Should I do a crisscross pattern? In your owner's manual, there is a face that's in there that does show different ways, or actually it shows a pattern of how you can choose to do your microderm treatment. I personally just find the sweeping motion much easier. I just keep repeating the same area over and over again until I actually get the pinkness that I want.
Yeah. Feel better already.
Okay. Now I'm going to have you go ahead and make a chin for me. Thank you. The reason I'm having you make a chin is we get a lot of little milia and congestion right in through here. And that way it just kind of pooches it out so it's easier to get in there and remove them. And even though I've gone over your chin numerous times, your chin can kind of take it. Okay, go ahead and relax. How are you doing so far?
Very good, thank you.
Good. Okay. So I'm going to go ahead and start on the other side of the face. And I'm going to just start right here at your cheekbone area. Is that too much? Or are you okay?
I'm okay.
Alright. Now, I'm keeping it at the same level for this area right here because you don't need to necessarily turn it down because this area isn't quite as uncomfortable. If Amy had said though, oh, it's uncomfortable, you want to go ahead and turn it down then. But once again, you want to look to see how the skin is changing, and we can already see that it's turning a nice pink color, which is perfect. We're getting a nice good crystal flow, which is great. So let's see what we got. It's perfect. The other nice thing is too, as you can see that she's turning pink, and if you were to now look at her forehead, it's calmed down considerably. So this is not a treatment where people are going to leave and they're just going to be bright, bright red all over. In some cases, the higher you go, sure, they might, but for someone's first initial treatment, you want to make sure that they leave with some slight erythema color, but not too bad. So now I'm going to turn it down because I'm going to be working in this section, okay? And once again, you just tell me if it's too uncomfortable. You okay? Mm-hmm. Okay, good. Sometimes what you'll notice also is one side of the face is going to be more sensitive than the other. Completely normal. completely normal.
You're right. This side's a little more sensitive.
Yep. The other thing too, you might notice if someone isn't feeling well and they come in for their treatment, they're going to be more sensitive. A lot of people ask, well, can I do waxing in conjunction with microderm? I wouldn't necessarily recommend it, because if you think about it, we're going in there and we're really manually scrubbing the skin here, and then by waxing, it's just too traumatic within one visit, so I would separate them if I were you. So this side was more sensitive, huh?
A little bit, yes.
Okay. Perfect. So now what I'm going to do is I'm going to go above your lip over on this side, so I'm going to have you stay right there for me. And I'm just going to stretch it out slightly here. Once again, as you use your machine, I highly recommend that you play with it and figure out what's going to be the best way for you to use it, what's going to be the easiest way for you to use it. That's all I did. It was just kind of messing around with it on myself and on other individuals that were in my office to really get a full feel for it, which is perfectly normal. And like I said, you don't necessarily have to do the sweeping motion that I do. You can change it around if you want to a little bit. You